Assalamualaikum and hello everyone. So in this video kita akan tengok serology test for hepatitis infection. Kita akan tengok immunologic markers dan we try to interpret lah. Okay. So patient confirmed diagnosed with hepatitis B viral infection dalam case ni. Because hepatitis B surface antigen positive, and then I can remember the case, and hepatitis A IgG also positive. Kita akan discuss lepas ni. Now we're focusing more on this table. This is serology test. Okay. Bila patient kita suspect ada hepatitis, kita akan order untuk serology test. Ada 3 indicator yang penting. 3 most important indicators in order for us to come out with diagnosis of hepatitis viral infection. The first one is hepatitis B surface antigen or HBsAg. This one. Hepatitis B surface antigen. Second one, antibody towards hepatitis B surface, which is anti-HBs. Anti-HBs. And the last one is anti-HBc, antibody for hepatitis B core antigen. Ini adalah 3 indikator yang penting lah. In order for us to screen ataupun kita nak confirm this patient ada hepatitis viral infection lah. Alright. Another one is one additional markers is hepatitis B E antigen. Why I say that only 3 indicators important untuk kita measure hepatitis infection, which is hepatitis B surface antigen, HBsAg, antibody towards hepatitis B core antigen, anti-HBc, dan antibody towards hepatitis B surface antigen. Kenapa saya kata 3? Because HBc itu, in order for us to measure how contagious patient are. Okay. In order for us to measure how contagious patient are. How far they can transmit the virus to other people. Okay. Itulah basically dia punya reason, this one. And usually is not part of diagnostic panel. But kita nak tahu, kita just nak tahu sama ada virus atau tidak dalam patient itu. Bukan sama ada patient itu boleh transmit the virus kepada orang lain. That one is additional info. Okay. Yang penting, first thing is kita nak tahu either patient has hepatitis virus or not. Okay. So in first situation, we're focusing on hepatitis B in this case. Hepatitis B surface antigen negative. All 3 of them are negative. Okay. Maksudnya patient tidak dijangkiti. Patient is not infected. This person is not infected at all. Neither infected nor vaccinated. Maksudnya patient belum menerima vaksin untuk hepatitis B, as well as this patient has not been infected by hepatitis B virus before. And also, this patient does not have active infection at this moment of time. So, kita categorize this sebagai susceptible. Maksudnya, boleh jadi in the future dia akan dapat. Okay. So, what we have to do with this patient is untuk dia ambil hepatitis B vaccination. Faham? So, second interpretation is bila surface antigen negatif, antibody for core positive, antibody for surface antigen positive. Antigen first invade immune system. Waktu itu belum ada lagi antibody. At that moment of time, body has not contained any antibody against the virus itself mula-mula. But as the process goes along, with all the inflammation, infection, and immune response, our body will produce antibody. Once the infection resolve, the antibody will remain in our body in case of future infection, and to protect patient from getting getting complication lah in case of future infection. We don't know. Okay. So bila there is presence of antibody, maksudnya that one infection is pada masa lalu, in the past lah. Sebab apa? Sebab dah ada antibody. Maksudnya infection itu happen in the past. Sebab dah ada antibody. Tapi kalau antigen itself, maksudnya ada active infection. That's what it means. So in this case, sebab dia ada both antibody for core antigen and also surface antigen, but the antigen itself negative, not detected. Maksudnya this patient sudah resolve, sudah sembuh from viral infection. Maksudnya sebab ada antibody. Third case, antigen negative, surface antigen negative, antibody towards core negative, but antibody towards surface antigen positive. Because this patient is vaccinated. Vaccinated patient. Sebab vaccination is all about kita introduce attenuated, weakened virus into patient's body. And what we anticipate is the immune response untuk producekan antibody. So the one that produces adalah untuk surface antigen. Is for surface antigen lah. Right? And then this case, fourth one, case ini antigen positif. Tadi yang semua dekat atas ni antigen all are negative lah. First case negative. First 3 cases are negative. Means there is no infection, current infection, no active infection pada masa itu. But in fourth case, antigen positive. Antibody towards B core positive. But untuk B surface negative. So not yet developed untuk surface. So it indicates an active hepatitis B infection. Sebab apa? Sebab there is presence of antigen. Antigen has yet to be removed by antibody, by immune response. Okay? So bila ada antigen means belum resolve. Still in phase of infection. Masih berlaku infection on that patient. Okay? And then ada mark kat sini. If anti-hepatitis B core IgM present. IgM indicates itu adalah acute infection. Not to say acute. The first antibody being produced by immune response towards and intruding antigen. Okay. So bila anti-hepatitis B core IgM positif ada present, maksudnya itu ada baru, patient baru menerima infection. Tapi kalau IgG, patient sudah lama menerima infection. Okay. And the last one is antigen negative, core antibody positive, surface antibody negative. Maksudnya this one is leading to chronic sudahlah. Banyak dia punya interpretation. It can be chronic. No, bukan chronic. Either highly likely to be false positive, because core suddenly positive, but core antibody positive, but surface antibody negative. So it can be false positive ataupun distant resolve infection, and then mungkin baru recover from acute infection. Boleh jadi all these things lah. Alright, so that's it.